Great. Hi guys. Today we're here to talk about acupuncture and how acupuncture can really make a massive treatment in how you treat and diagnose your patients. It is fantastic to help isolate a muscle group or a nerve or soft tissue that you want to work on. So there's multiple different ways of doing acupuncture. One of them is simply by just putting a needle in and leaving it. That's more traditional Chinese medicine, and then that needle will stay there in various points to help balance the body. Another type of way, which is what traditionally I do more of, it's called neurofunctional acupuncture. So you would take your acupuncture needle and you would put it to a specific depth to either hit a nerve or the outside of a nerve or the outside of a muscle, and you want to see a muscle twitch by putting something like a pointer plus or a current through it, and that would allow the muscle itself, you'll see the muscle belly twitch and you'll see it move, and that resets the system back to its resting tone, which is very important because often muscles that are in distress have a higher resting tone, and that will bring it down to normal, which is why we do a lot of acupuncture. Or I do a lot of acupuncture, I should say. Another way of doing it is through a series of needles where you could affect both. You want to do spinal, you also want to do peripheral points, so anything below the knee or below the elbow will have a central nervous system response, so something that's affecting the brain, which is really important. And then also local, so say for example if our patient had a quadricep injury, and that's affecting the knee or the knee affecting the quad, and we're doing needling to the quadriceps, I'd want to make sure to include a point underneath the knee so that we're having a central effect, and if possible into the back as well, just so that you have that spinal effect. So you're treating at the nerve root, the central point, and the actual local point. So that's neurofunctional acupuncture, and then there's other ways of doing acupuncture such as deep needling or dry needling, and that's where you just put the needle in and you repetitively hit a trigger point. You just want to keep jumping, jumping, and jumping. So various ways of doing it, which is wonderful because all of them are necessary for different aspects, and depending on who you're working, how to meet the person at where they are and where they come in. So before we do acupuncture on a patient, we do explain the risks, contraindications, and indications of doing acupuncture. We discuss if it is potentially the best or if there are alternative aspects of treating a patient. Written consent is necessary for us to do acupuncture for the first one, and at any given time you are more than welcome to withdraw consent, and also have an informed discussion so that you know what is happening while treatment is occurring. Now with acupuncture, sometimes it can feel like nothing, which is what we ideally want, but sometimes it can lead to discomfort. So it's very important, especially with the type of needling that we do in here, that there's no discomfort, no pain, because you'll feed up what's called a pain feedback loop. And so if you have an acupuncture point that's, say for example, right here, if it's painful and I keep stimming it, it's giving you more and more pain, what that's telling the brain is that something's wrong. Tighten the muscle up further. That's the last thing that we want to do because we're trying to actually release it. So by doing that, we have to create a positive feedback loop. And so what we do is we put it in and make sure it's pain-free stimulation, and then pain-free stimulation, and that will revert back to the brain being like, hey, everything is normal, chill out. That is the goal of doing this, and so it's really important to make sure everything is pain-free. We're going to start with our first technique, which is more traditional Chinese technique. It's just to balance the body. It's just 4 gates. It's to calm the system and basically give the system what it needs. Really important, especially if you're having someone that's really fatigued or not sleeping very well, being anxious, stressed, all those things. You want to be able to calm down the system so you can actually enter it. So we're going to start at the top of the head. So you're just going to put one just at the top. Beautiful. The 2 hands and the 2 feet are what in Chinese medicine create the 4 gates. And the 4 gates are the most powerful points in the body. So in the feet, these are your most powerful points in the entire body. And then the upper extremity, Li4, is the most powerful points in the upper extremity. So you can see how it literally combines together. So very powerful. There we go. So her points are complete. We're going to be doing a quadricep simulation today. So I'm just going to be lifting up the patient's wrist with permission. Do I have permission to do this? Thank you. I'm just going to tuck it up and underneath. And what you're going to do is you're just going to bring your finger all the way up and you'll find the divot there. Sorry, Nina. Put your acupuncture point there. Tapping it in. There we go. So we just get down to the level that we want. So every acupuncture point is a divot. That's really important to learn as well. So if you look at any acupuncture point, every single one is a divot within their body. So when you're learning acupuncture, it's really fun and good to know that because it helps you landmark really well.
I felt it.
Did you feel it?
Yeah, I did.
Do you feel it more on that one?
Yeah, yeah, I do.
Okay.
Oh, yeah.
Okay, she just had a little bit of blood there, so we're just going to draw it up and then throw that in the garbage. So now we've got our points here. Because we have already done the gates, I don't have to put another peripheral point because I have something below in each limb, which is perfect. And because clearly she's face up, I can't do her spine in this way. But if I was to do a longer treatment session, I could. So we're just going to take our electrical stimulation box. The black lead, if you can, always try and have it towards the end of the limb or the distal aspect of the limb, and then red's always the closer or the more proximal aspect. And there we go. And so now what we're going to do is we're going to just slowly, comfortably, and making sure you're discussing this with the patient, let me know how this is feeling as we're turning it on, making sure there's no discomfort, but just a mild jump. So if you look down here, she'll definitely start to jump, and you'll see that quadricep jumping. Do you feel it jumping there?
Very, very light.
So you can see them jumping here and here. So this is the first lead on. And then the second lead's about to come on, so you'll see this increase in intensity. So you can already see this one's already turning on. And now the lateral's going to be coming on as well. There you go. So that's a full quadricep stimulation, so you can see that the whole leg is jumping now. So this is going to be more of a single point stimulation. So for example, on this patient today, she's having a lot of issues with the radial aspect of her arm, so the outside of the arm. So what we want to do is we want to help settle that down. So anyone for like tennis elbow pain or issues just along the back of the arm, or just even tightness, this is really, really helpful for that. So if you just come down the arm, I'm going to find my point right there. And you're just going to go in. Going to depth. Perfect. So there. And then I'm going to stimulate that point. A little bit more juice. No, I'm slightly off. It's okay. So if I feel slightly off, because the thing is, this is millimeters we're talking about in terms of the needle itself, it could just be that your angle is off, so not 100% there, so I'm just going to stim it. You can see there, I got the tricep. Patient, is that comfortable?
Yes.
Right, so you can see that tricep coming all the way down. And what's really cool is I'm stimulating the tricep all the way up in the upper arm, but you can see how it's starting to get the entire length of her arm, because as I'm doing that, do you see the vibration go all the way through? So it's amazing how we're all connected and we're not just one area.
Mm-hmm.
Perfect. Okay, so then I would take that point out, and then that is complete. So that feels promising. You feel it?
Yeah, because I felt it in the elbow.
Okay, ready? There you go, that's a radial nerve. So you can
Doesn't mean do nothing, like it's just like...
And so you can see as soon as I take the pointer plus off, it stops, and as soon as I put it on, that's back on. So that's huge, because anyone with radial, someone that needs any type of help with the radial side of the arm, this is huge and engaging the entire nerve, and it's comfortable, which is nice.
Yeah, it is comfortable.
Making sure no pain for the patient. So on,
no pain.
And what I'm looking for underneath my hand too is also for it to soften, and you can see how that softens, so this is wonderful. There we go. And that's it for today. Perfect.